Hi, I'm Dr. Collins Harrell. I want to tell you a little bit about how I got started in orthodontics. I graduated from dental school with very little experience, like most of you, with any orthodontic education or orthodontic experience. But I was interested in starting aligners because everybody was excited about Invisalign. And so I tried a few Invisalign cases and realized that I didn't know enough to not get into trouble. And I was concerned about starting cases and having to refer them not finished and not knowing what I was doing. So when the recession of 2007 hit and I was looking for ways to increase profitability in my practice, I looked at the different specialties that I referred to and tried to figure out which one would benefit me most to get additional education in. And I found that I was referring most to the orthodontist. I have a young practice with lots of young families, and I was referring a lot of cases out to orthodontists. So getting more education in orthodontics would be a way to refer out less work and keep more in the practice. And I wanted to know more about orthodontics because parents would ask me, hey, does my son or does my daughter need braces? And I really wouldn't know how to answer them intelligently. I didn't really know what I was looking at except the real obvious cases. And so I thought, hey, even if I don't end up doing a lot of ortho, it'll be great to know more and be able to talk to my parents and my patients more with better education. And so that's really what spurred me. I had an uncle who had graduated from POS, actually my wife's uncle, and I really enjoyed the way that he did orthodontics in his practice. I could tell he was really good at it and did a lot of it. So I asked him where he trained, and he told me Progressive Orthodontic Seminars. So that's when I reached out to Progressive Orthodontic Seminars and took the traditional 48-day course in traditional braces, and I loved it. It seriously was the best education that I've ever had apart from dental school. I feel like it made me a better clinician even outside of doing orthodontics. It made me see the mouth different, see the patient different, understand how and why teeth move. And so whether I was doing cosmetic dentistry or restorative dentistry, the education that I got from orthodontics made me see my patients more completely and understand better how and why everything was working the way it did in the mouth. And so I've loved doing orthodontics in my practice. I have done a lot of braces in my practice. I increased the number of aligners I was doing because now I had better understanding of how to do braces and aligners. And I had the confidence that if something didn't work out with aligners, I could always put braces on and finish the case up. So that's really what got me into doing orthodontics in my practice. And probably for me, the most exciting part about doing orthodontics in my practice, beyond just knowing more and having more to offer to my patients, is the energy and the excitement that doing braces brings into my practice. My staff loves it. I love doing cosmetic work, and on adults we have fun doing cosmetic work, but on our kids we don't really do cosmetic work. So there's not a lot to offer them in our practice besides the toy box. And when they come in for braces or for aligners, we're able to offer them something that they're excited about. And so to have 8, 9, 10, 11, 12-year-old, 14-year-old, 16-year-old kids come into the practice excited about what we're doing, seeing their confidence increase, seeing them smile more, seeing them feel better about themselves, carry themselves differently, talk differently, smile differently, because we're making a positive change in their life was really, really rewarding and really fun and exciting for all of us in the practice. I love getting referrals from my young patients. You know, when we get a whole new family come into the practice because Johnny or Susie, who we're doing braces on, is really excited about what we're doing for them, and then they tell a family about it, and then we get a whole new family to the practice from one of our young patients. That's pretty cool, pretty exciting. So the difference between doing aligners and doing braces, I wouldn't say that one is better than the other. They're just two different tools that we can use to straighten teeth. So if we can understand the strengths and the weaknesses of each of the different way of doing braces or doing aligners, then we can approach it differently and pick the best tool for the job. There are a lot of cases where it doesn't really matter whether we do braces or aligners. I feel like I can get a great result with either tool. So in those cases, I present to the patient that we have a choice, and we talk about the strengths and the weaknesses of the aligners versus braces. I think the strength for the aligners is they don't look like they have braces on. They can remove them to eat, they can remove them to clean their teeth. Those are really the strengths, but the weakness is they can remove them. And so if they're not going to be really good at complying and wearing the aligners 22 hours a day like they need to get a great result, then we're not going to be able to straighten their teeth well. And the strength of the braces is they're on 24 hours a day, they can't remove them, and so they work really well for patients who maybe have problems with compliance or wearing them the amount of time they need to wear the aligners. There are cases though where braces are a better tool. So if we have a lot of severe rotations, a lot of root tipping, we need to do mechanics, we need to control torque. In those situations, braces often do a better job, and I'll encourage the patient, to consider braces. We can still do it with aligners, but maybe we won't get quite the A+ result that we would get with braces. So there are cases where I'll encourage braces, and then there's some cases that work better with aligners. For example, an open bite case. If we have dental open bite in the front, we do get a better result if we treat that with aligners. And so there are cases where I actually encourage my patient toward aligners in order to get a better result for them. But most of the cases, I kind of let them make a choice based on whether they think they're going to be compliant with the aligners. And if they see the strength of the aligners and also the weakness, then they can make that decision and own the result. So if they're not wearing the aligners enough and their teeth aren't getting straight, they understand why. I feel like doing ortho in my practice is the best decision that I've made apart from deciding to become a dentist. It's really enhanced my career, and it also has increased the profitability of the practice. So it's been a great decision for me, for my staff, and it worked. The reason why I would encourage getting a progressive orthodontic seminar education versus like an Invisalign certification. Invisalign, I went to their certification, I was there for 2 days, and I didn't really learn much. I learned how to do a very simple case, and I learned which cases I need to refer, which seemed like most cases. I don't feel like I came away with a real orthodontic education. Taking classes from progressive orthodontic seminars, in my mind, is a real orthodontic education. I feel like I'm learning the things that I would have learned if I would have gone to 2 years of orthodontic specialty training. It's a comprehensive program. We learn everything about orthodontics. We learn everything about diagnosing and treatment planning properly so that we know what we're doing and we're making the decisions rather than relying upon the technicians behind the aligner company to make treatment decisions for us. We're the doctors. We should know what we're doing. We should know how to diagnose and treatment plan our cases. And so doing my education with progressive orthodontic seminars, I think, gave me the confidence to be able to take on any case that I wanted to treat in my practice. Plus, there's mentors and consultants that give me the confidence to go and treat a case, knowing that if I have questions or concerns or something's not going right, I can reach out to my mentor, consultant, and get the help that I need. And I feel like this helps me present to my patients the fact that I do orthodontics and that I can treat their case. I can speak with more confidence and feel more confident about that because I have people backing me up with the skills and knowledge to know that I can be successful in all the cases I decide to treat. I think the funniest excuse that I've heard regarding aligners was that their dog chewed it up that very morning, and the dogs do like the aligners that have been in people's mouths. They are attracted to that, but that was the funniest. Was they're like, literally just this morning, I was just going to call your practice before I saw you. I literally just had my dog chew up my aligners this morning, and could have been true. The things that I've really liked about doing aligners in my practice that's been really positive for me, and I'm thinking of one patient in particular who really wanted to straighten his teeth, but he was going into military service and knew he couldn't have braces because he wasn't going to be around frequently enough. So having the ability to offer him aligners and knowing how we could treat his case with aligners in such a way that if I don't see him, except maybe once or twice a year, that we would still be able to be successful. And he was really excited about that. So we came up with a treatment plan that didn't involve putting engagers or attachments on his teeth, moving the teeth slowly enough that if he was good about wearing his aligners, we would be successful. And so he took his aligners with him. We gave him all the aligners that he'd need. He was deployed and was away for quite a period of time. And it was really cool to have him come back and see that he'd made tremendous progress, that everything was on track. He was excited, things were working. He picked up the rest of the aligners when he was back after 6 months and was deployed again. And when we saw him the next time, the case was complete, and he had a great smile and was really happy. So for me, that was really satisfying to know that I could treat a case using aligners when the patient wasn't even able to be there, but really wanted to be able to have the case treated. And so that was really fun for me. On the flip side, I have a lot of patients walking around town that I'm treating with aligners. And when I run into them, they'll often not have their aligners in, and they'll start talking to me, hey, how's it going? Then all of a sudden realize they don't have their aligners in, and then feel embarrassed and have to make up excuses for why they don't have their aligners in. So that's been a funny part about doing aligners in my practice, is just wanting to say hi to people, and then they feel self-conscious and embarrassed that they don't have their aligners in, and they have to start coming up with reasons and excuses as to why they aren't wearing them right now, and assure me that they usually are wearing them. Well, when the COVID happened, we started a whole new platform teaching people virtually on Zoom, which was a new experience for me, and took a little time to get used to. I think Zoom had some positives, some pros. I think there were some drawbacks as well compared to teaching in person. What I like about Zoom is that we can meet together for 2 hours, once a week. People can be comfortable, they can be in their homes, they can be in their pajamas, they can be, walking around with headphones in, listening, doing whatever they need to do. So it's really convenient for all of the doctors that want to take the classes. The downside for me is I don't get the feedback. So when I'm teaching, most of the doctors have their cameras off. So even the ones that have them on, it's kind of hard to look at them while I'm also looking at the course material. So I don't get that feedback from my students that I do when I'm teaching live, where I can tell they're getting it, I can tell that something's making sense to them, or I can tell by looking at their face that it's not quite making sense and I need to explain it differently. I think when we're in person, live in person, we kind of feed off of each other, and I feel like people feel that they can ask questions more easily, participate more in the conversation. So that element of being live in person, now that we're back live in person, I've really enjoyed, again, being with the classroom and just feeling each other's energy as we teach. Plus, I feel like the doctors that come to a live in-person course have set that time aside for the weekend or whatever day we're teaching, and they're there, committed, giving the time to really learn. And sometimes when we're at home on Zoom, we get distracted, there's other things going on. We know it's recorded, we can always go watch it later. So I think that it's convenient in that you can be wherever you want to be. We can gather around the world, we can have different people from different countries in the same course. And that's fun. It's fun to be able to gather easily and do courses that are shorter so people don't have to travel. And I think it gives us a lot of flexibility. But I do miss that interaction one-on-one and the energy that we share when we're together in a classroom.